Dear colleagues, it's a great pleasure and honor that I was asked to give you this lecture today on my latest book called Super Sperm. And this is what all males would love to have, to be like a Superman, especially having super sperm. Now, if we define super, what is this actually? Well, it's an adjective that describes something as of the highest power or an extreme degree or as excellent. And we know this from super petrol, which we all obviously want to put in our tanks of the cars. Now, let's just go into some infertility facts. As an estimate of 186 million infertile people exist globally, and it's around 10% of all couples. 50% of infertility cases are caused by a male factor. A total of 8 million children have been born since 1978 with the introduction of IVF, and approximately 50% of those were conceived by ICSI. Now, for Denmark in specific, my country, 10% of the Danish birth cohort derives from some kind of ART. Now, there are some very important facts about males I think that we need to focus on here. And for Denmark, 20% of Danish males have a low sperm count that is below the WHO criteria. And 25% of Danish males will never father a child. And even more importantly, childless males feel more isolated and depressed than females in the same situation. Why did I write this book? Well, I wanted to remove the taboo concerning talking about sperm. Sperm needs to be brought into focus here in 2022, and also because the male role in society is changing. The male should take responsibility for his body, and by doing so, he's also taking responsibility for his offspring. And importantly, there is also a biological clock ticking for the male in line with what we are seeing for females. So what I suggest in this book and in general is a fatherhood preparation period of 3 months prior to conception. Now, if we look into semen as a whole, it's connected with a lot of taboo. It's concerned with guilt, with shame, with sex, and masturbation. And here you see this sneaky sperm contrasted by these wonderful white eggs. And we all know that if during a dinner conversation someone would say, well, my eggs are not very good, it would be okay. But starting to talk about sperms, it's a no-go during a dinner talk. Now, where did all this come from? Well, this is actually back in history. We have to go all the way back to the first book of Moses, in which the son of Judah, Onan, was asked to impregnate his deceased brother's wife. Now, he refused to do so, and instead of going through a full sexual intercourse, he wasted the sperm on the ground, and due to this, he was punished with death by God. So you could see already many years ago, there was like a death penalty for masturbation. And we still see signs of this today, because in this Danish survey from 2019, 8% of males and 10% of females were ashamed of masturbating. And when we talk about infertility, men are still on the sideline, because culturally, fertility belongs to the female. As stated by a very famous Danish gynecologist, a woman is considered responsible when she considers her inner organs, ovaries, womb, and vagina, and her functions as a wife and a mother-to-be. Now, the problem is here that this then states that fatherhood belongs to the male, which obviously will turn infertility into a problem of the female. And this is what we see in a lot of countries still, in which there is no open debate regarding infertility. So focus will always be on the mother-to-be. The eyes are firmly fixed on the woman, and the man has just been reduced to a semen blob, something objective. And the problem is that the male doesn't regard his semen as something that he should protect. But spermatogenesis is a highly complicated process. More than 2,000 genes are needed to produce one sperm. and approximately 1,000 sperms are produced in the testis per second. And finally, up to 96% of sperms are abnormal, and this is obviously why the production is so high. Now look at these four guys. They're having a wonderful evening out in town, and you can see the drinks are there, the smoke is there, and there's a lot of debating. One thing I can assure you they're not talking about, they're definitely not talking about their sperm count. Now, how do males react if they have a low semen count? Well, we looked into this and published the study in 2013, 210 males who needed ICSI treatment during ART. And they answered a questionnaire, and what we saw was that 28% of the males reported a negative impact on their masculine self-image. 62% missed communication with the staff regarding their challenges with a reduced semen count. And 63% felt that the communications was primarily directed at the female partner, although the reason that they were in the unit was actually their problem. Finally, 72% lacked information about male infertility. Now, this is for a Danish population, but I'm sure this applies to the general population, at least for Europe. Now, what is the current state of semen quality? Well, this is the Semen Analysis 2022. And remember, please remember that the first, let's say, semen analysis described is dating back from 1916, and not a lot happened during these more than 100 years, because what we are focusing on mainly still is concentration, motility, and morphology. If we go into the WHA criteria, you can see it's again concentration, it's the percentage of motile sperms, the motility grading, the morphology, and the total motile sperm count, just like back in the early 1900s. And as of now, the cutoff for normal semen quantity is 16 million per mil, as described by WHO. The problem, however, is that time to pregnancy, if you want to conceive within 1 year, you need more than or equal to 40 million per mil, as elegantly shown in the Lancet paper from 1998. This also means that a lot of young guys will leave their GP being told that they have a normal semen count, although the time to pregnancy is going to be considerably higher than just 1 year. Because the Danish male with 2 kids will on average have 80 million sperms per mil. Now, this is a very worrying paper. It shows a sperm concentration in free fall, and it's 40 years, and it's more than 40,000 males. And you can see the focus here is on the sperm concentration and the total sperm count. And what we see is that there is a decline of more than 50% over 40 years in these Western countries. So this is North America, Europe, US, Australia, and New Zealand. And this applies to a 1 to 2% decline in sperm count per year. So very worrying over those past 40 years. And you can ask, so what about other countries? Well, we see the same trend. This is now 14 years in China, from 2001 to 2015. Again, a huge sample size. What we see is that the sperm concentration, the mean concentration, has decreased from 68 million per mil to 47 million per mil. So something is happening in China also, definitely. So what about Denmark as a whole? Well, William Shakespeare wrote, "Something is rotten in the state of Denmark." Obviously, he was not thinking of the sperms in those days. And this box tells you, if something is rotten in the state of Denmark, why don't you just have a mint? Well, I'm sorry to say, a mint is not going to help the semen count presently. This is a study including Danish conscripts, more than 6,000 participants. This is approximately 300 per year, and the years were, as you can see, 96 to 2016. Now, we all know that the Danish semen count has always been considered quite low. And this is what we see in this table, because here 16% had below the WHO criteria, so they are here. But 35% had a low quality based on combined parameters, and only approximately 20% had more than 80 million per mil, so quite worrying. When we talk about quantity, obviously more important is also the quality. And how do we actually measure quality when we talk about sperm? Well, I think the most important tool that we have in our hands today is the sperm DNA fragmentation, SDF. It's like digging just a little bit deeper into the soil instead of this old analysis from 1960. Because what we know is obviously that DNA is like a double helix from two complementary strands of nucleotides, which are held together by hydrogen bonds between GC and AT base pairs. Now, sperm DNA fragmentation is like fragmenting these hydrogen bonds. So you can compare this to rail sleepers, in which if you have a problem with the rail sleepers, you're going to have a derailment. And you're also going to have a derailment here in terms of fertilization and early embryonic development if you have DNA fragmentation of a certain degree. Now, as for DNA structure and stability, DNA is damaged by oxidative stress, and DNA damage occurs more than 100 times a day in a human cell. But the good message is that the somatic cells are capable of restoring DNA damage. If not, they will die within a few hours. And importantly, DNA damage, that is mutations, may induce cancer and other diseases. Now, if we go into the sperm and look into DNA damage, the important thing here is that the sperm cell cannot repair DNA, and sperm DNA is tightly packed to protect the sperm from damage. Importantly, the DNA damage cannot be visualized on the surface of the sperm, and sperms that are damaged, they are still motile, they can fertilize either naturally or during ART. So what we can say is that the sperm cell is actually an excellent canary in the coal mine. Please remember, in the old times, the coal miners would bring a canary into the mine, sitting in its cage, and if there was like an outlet of gas, well, the canary would fall down at the end in the bottom of the box, and everyone knew that now you needed to go out. And this is the same system here with the sperm. The sperm reacts like a whistleblower. It tells you that something in general, usually oxidative stress, is increased in the body. Just 1 year ago, a group of specialists in DNA fragmentation and infertility sat down, and we came up with this summary evidence and clinical practice recommendations concerning DNA fragmentation testing. Now, how do we measure DNA damage? Well, we have 4 ways to analyze, which are very, very similar in their responses. We have the SCSA, we have the sperm chromatin dispersion test, the tunnel assay, and the COMET assay. Now, as for those, a sperm DNA fragmentation more than 20% is considered pathological. So if more than 20% of sperms have DNA fragmentation, this is going to create problems. Now, how often do we find a relevant increase in sperm DNA fragmentation? This is an analysis of more than 1,600 males attending a fertility center. And here you can see that more than half of these males had a sperm DNA index, sperm DNA fragmentation index of 20% or greater. Now, if we look, and this is again from our paper, we look into the recommended procedures for SDF testing. Again, you see that 4 different assays. Also, the idea of abstinence times, which will vary from 2 to 5 days prior to analysis. The thresholds seen, which we suggest is that more than, or rather from 15 to 25%, you are going to find more increased risk of male infertility. And in those males who are above the cutoff of 20%, you're going to see a decreased chance of pregnancy by IUI, IVF, or ICSI. I'd like to take you back to our first paper on this issue, and this is a highly cited paper. So this is, as you can see, from 2007, and the idea was to look into the sperm DNA to predict the ART outcomes. And here you see for IUI, and we have two categories of patients. We have patients less than 30%. This was our cutoff in those days, a sperm DNA fragmentation less than 30%, above 30%, and this is now IUI. So these are obviously normotospermic males. What you can see is that those who were less than 30% had a delivery rate of 19%, versus those who were above 30%, their delivery rate was just 1.5%. So if we look into the same aspect in IVF and ICSI, you can see that the delivery rate is significantly lower if you use IVF in high sperm DNA fragmentation as compared to ICSI in high sperm DNA fragmentation. So 26% versus 44%. Now, what we saw already in those days, and I think this is extremely important, 20% of normotospermic males had a DFI above 20%. So these guys were just walking the streets thinking that their sperm concentration was completely normal. So 1 in 5, but in reality, 1 in 5 will have a DFI above 30%, and then they will face severe problems obtaining a spontaneous pregnancy. And even if we do IVF in these males, we're going to have a significantly lower live birth rate. So subsequently, DNA meta-analysis on DNA damage and clinical pregnancy rate emerged. And here you see that this is now the odds ratio showing the negative correlation between DNA damage and clinical pregnancy, and the odds ratio is 2.3 negatively. So the higher the DNA damage, the lower the clinical pregnancy rate. And I think, as you can see, most studies actually agree that the odds ratio are in favor of negative impact of high DNA fragmentation. We also have a more recent analysis. Now here you see, with including more studies, here you see a mixture. A is a mixture of IVF and ICSI. What we see is that the implantation rate by DNA fragmentation is significantly reduced. So is the clinical pregnancy rate. But if we look into the live birth rate, obviously, usually not a lot of studies report live birth rate, but the studies who did not, in this compiled analysis of IVF and ICSI, see any difference. If we now substratify and look only into IVF, we see exactly the same that we saw in the Bongom et al. Paper. So in DNA fragmentation, you have a significantly lower implantation rate, significantly lower pregnancy rate, and borderline reduction in live birth rate. In contrast, if we look into ICSI, well, there's no significant difference. There's a trend, but no significant difference as for implantation rate, pregnancy rate, or live birth rate in terms of an increase in sperm DNA fragmentation or not. So these results corroborate exactly what we saw in the initial study from 2007. So the idea is here that if you have a patient with a high DFI, or high SDF rather, sperm DNA fragmentation index, well, you should actually do ICSI rather than IVF, because the affected sperms will produce reactive oxidative species during the incubation period. And this is probably why, if you do ICSI, you will avoid this negative impact from the affected sperms by selecting the sperm quite quickly after the ejaculation. So let's look into male biological aging. Well, this is the world's oldest father, Ramjit Raghav, 96-year-old. He fathered 2 children, and actually he wanted more when this picture was taken. Unfortunately, or maybe not unfortunately, he passed away at the age of 104 years. And why do I say maybe not unfortunately? Well, because there is a significant correlation between male age and DNA damage. Now, more than 25,000 males, and here you see on the y-axis you have the DFI, on the x-axis you have the age, and what we see is from the age of 45 and onwards, you have a clear, significant increase in DNA damage. Another study, 16,000 males, we see exactly the same from the age of approximately 40 and onwards, an increase in DNA damage. Now, does this affect the offspring? Well, we have to realize that more than 75% of the human germline mutations are of paternal origin, and their total number will increase with the age of the father at the time of conception. So it was stated in 1997 that the greatest mutational health hazard to the human genome is fertile older males. This is a very excellent study from Iceland in which entire genome sequencing was performed in 78 fathers and their offspring. And here on the x-axis, you see the age of the father at conception, and on the y-axis, you have the number of de novo mutations. And again, we see this correlation between de novo mutations and the age of the father at the time of conception. So does this matter? Well, it actually matters, because the higher the degree of DNA damage, the higher the risk of child cancer, child leukemia, metabolic disease, and neuropsychiatric disease, as in terms of bipolar disease, schizophrenia, and autism. So yes, there is a risk. Now, obviously, we cannot do a lot about aging. I mean, this is impossible. But we can do something about lifestyle, because if the biological clock is ticking, and on top of this, we have a lifestyle which increases DNA damage, we're going to have a double negative effect. Now, for lifestyle and DNA damage, I think the most important thing is nicotine. Nicotine in terms of cigarettes, e-cigarettes, chewing tobacco, snuff, and cannabis. Other lifestyle factors obviously are an excessive use of alcohol, too much caffeine, the diet, which in the Western countries is now fast food, overweight, which is increasing, sedentary life, very little exercise, very tight pants, heating up the testicles, which increases the DNA damage, a lot of mobiles in pockets for many hours every day. Please remember that there are electromagnetic waves which come out of these mobiles and the computers, and the range is from 900 to 1,800 megahertz. So this has been shown in some studies to increase DNA damage. So if you keep your phone in your pocket close to the testis more than 4 hours a day, well, you are at risk of increasing DNA damage. So if we look into lifestyle, and let's say in an evolutionary aspect, here you see this middle-aged guy with a huge tummy, and he has obviously an overweight problem and a sedentary life, a very unhealthy lifestyle. He's probably also a smoker. So do you think from an evolutionary aspect that nature thinks that this man would be able to take care to get food for his family, to take care of his family? Obviously not. So nature somehow, from a biological point of view, will turn down spermatogenesis, because here spermatogenesis is not that important. It's more important for this person just to survive. Then obviously we have the environment, and here we talk about pesticides, phthalates, bisphenol, parabens, mercury, and the worst problem is that we all are surrounded by these endocrine disruptors in a toxic cocktail. So not just one, but we are surrounded by all of them, which obviously significantly increase DNA damage. Now, if we look into lifestyle changes versus environmental changes, I usually say, well, lifestyle change is the speedboat, whereas environmental changes is like the big oil tanker. So it's going to take a long time. And this is something we as humans cannot do a lot about. This is our politicians who need to take action to change the environment. Obviously, we can help, but the big political aspects are definitely driven by politics. In contrast, the lifestyle is something we can do very quickly and do a change. So, you know, JFK stated, ask not what your country can do for you, but ask what you can do for your country. And with my example, ask what you can do for your semen quality. Well, and this is where I suggest a lifestyle for the so-called, for let's say, parenthood. And obviously, the most important thing here is to get rid of nicotine. Just ditch it, all of it. Because if we look into the nicotine content in cigarettes versus the now more and more increasing usage of snuff and nicotine bags, you can see in a cigarette you have approximately 12 milligrams, but in some of these snuff bags you have up to 43 milligrams, and in some of the with less, you have 6 to 15 milligram in bags. Now in Scandinavia, this is an increasing problem because a lot of our youngsters, school kids, are using these bags instead of smoking. And obviously, nicotine is probably the worst enemy of normal sperm DNA. And the other problem is also that there is a higher nicotine serum level after one bag of snuff compared to one cigarette. So these are the suggested lifestyle changes for fatherhood preparation. Please remember that spermatogenesis takes 66 plus minus 8 days, so approximately 2.5 to 3 months. And obviously, for fatherhood preparation, you need to sanitize your lifestyle approximately 3 months before you try to conceive with your wife. The most important thing is to quit smoking, no more than 5 alcoholic drinks a week, caffeine a maximum of 2 cups daily, and exercise 30 minutes moderate intensity exercise daily. Please remember that exercise increases your own antioxidants. Then again, for the diet, it should be a diet containing less meat, so a maximum of 500 grams of processed meat a week, more fish, 350 grams a week, and more poultry. 600 grams of vegetables or fruit daily. Weightless if we need this. Get the mobile out of the pocket and keep the computer away from the lab. This is the electromagnetic waves that we want to get rid of. Another important issue here is also the correlation between sexual abstinence and DNA fragmentation. And here we have to admit, the shorter the abstinence, the lower the DNA fragmentation. So a healthy sex life is just good to reduce your DNA fragmentation, and you cannot have too many ejaculations. It's not going to hurt your semen. In contrast, it's going to increase the quality of your DNA in the sperms. Another important factor is the increasing use of antidepressants and DNA damage. And here we talk of the so-called SSRI inhibitors. So you can see on the left-hand side, paroxetine, sertraline, fluoxetine, citalopram, and escitalopram. So this is something which is increasing the use of these SSRIs. And do they have a negative impact? Yes, certainly they do. This is a study from 2010 in 35 patients. And what you can see, the percentage of sperm DNA fragmentation at baseline was around 14%, and this rose to 30%, more than double after 4 weeks of SSRI. And here you see, again, 10% of patients had a baseline sperm DNA fragmentation score of more than 30%, compared with 50% of patients at 4 weeks of treatment. So this is something we definitely need to take into account as reproductive specialists and ask our patients what kind of medications they take and should they take SSRI preparations. Well, I think we should encourage them to stop for at least 3 months before we're going to use their semen. So what about diet and sperm count? Well, it's always difficult to look into diet because most of these analyses have been derived from retrospective questionnaires. And this is the same for this one, but nearly 3,000 Danish males who were categorized into 4 dietary patterns, either Western, which obviously is the unhealthy, the prudent, which is the one suggested by the health authorities, the open sandwich, which is not very healthy, it's a traditional Danish dietary pattern, and then the vegan diet. And these participants reported how often on average they consumed specific amounts of 136 food items during the 3 months before enrollment. So what this study showed was that the high sperm count was seen in the prudent diet, that is, the diet suggested by the health authorities, followed by the vegan diet, open sandwich, and finally the worst diet, which obviously is the Western dietary pattern, including a lot of fast food and coffee and smoking, etc. Recently, we published this small pilot study looking into the combined effects of lifestyle intervention and antioxidant therapy on sperm DNA fragmentation and seminal oxidative stress in IVF patients. And you can see we included 31 males who had at least 2 failed IVF attempts. All of them had DNA fragmentation. We were using the SCASA test, SCSA test. They had sperm DNA fragmentation above 15%. And the males answered a questionnaire containing 68 lifestyle-related questions. Following the questionnaire, an individualized lifestyle change program was made for each patient, and males were then following this during a 3-month period. On top of this, they also received daily antioxidant therapy in terms of 1 multivitamin tablet, 1 omega-3, and 1 Q10 daily. Now, the interesting thing here is with this combined effect of lifestyle intervention and antioxidant therapy, 84% of participants achieved a decrease in DFI, and the mean decrease was 7.2%. We did not observe any differences in other sperm parameters, so no difference in concentration and motility. And we did not see any difference in seminal oxidative stress. So it just tells you, yes, lifestyle change definitely has a significant impact on DNA fragmentation. And the question is, should we be measuring DNA damage in human spermatozoa in 2022? And this is now, according to John Aitken, obviously we should do this. And for when should we consider what are the indications for sperm DNA fragmentation testing? Well, varicocele, which are known to increase the DNA fragmentation due to heating up of the testes, unexplained infertility, repeated pregnancy loss, prior to IUI, IVF, and ICSI, and also in patients who are going to be counseled about their fertility and patients who need to undergo sperm freezing. We should do this, and we should definitely include lifestyle advice. This is very important. And after lifestyle changes have been performed, we then should do a check again of the DNA fragmentation to see which treatment would be most optimal. And in my center, at least, and also in the centers by Esteves, if patients have lifestyle resistant decrease in DFI, although they have a completely normal semen analysis, we would opt for testicular biopsies. Here you see now the change which has taken place. In the old days, we were just doing a semen analysis and now nothing else. Now, if we take the sperm DNA fragmentation testing on board, then obviously there would be several issues to look into. Obviously, avoiding oxidative stress, suggesting oral antioxidants, but also treating underlying pathologies like varicocele, infections, And for ART, well, if no decrease in DFI occurred during a 3-month period, well, obviously we would go for ICSI in the majority of patients, but in patients above 30%, I would definitely opt for the usage of testicular sperm. So I'd like to refer you to this excellent paper on how to do your workup in these patients. So the infertile male in 22 has now become more than just a semen sample. We have to look at the infertile male as a complete, fully bodied person. This is the modern male. The treatment should be centered to him also in order to achieve a super sperm. And this is in the days of Renoir. You can see parties going on, smoking, drinking, etc. But I think we now learn so much. And obviously we should have a wonderful life. We should enjoy, we should drink or smoke or whatever we want to do, but not 3 months prior to conception. Because if we want to be healthy, and if we definitely want our offspring to be healthy, we should reduce the risk of passing on DNA fragmentation and increasing the risk of mutation in our offspring. So with this, I'd like to thank you very much for listening to this lecture. And here you see my staff in front of our common goal, which is obviously to achieve the highest pregnancy rates for infertile males. Thank you very much.